Now, there's been a massive climb down from the World Health Organization over plans to take over all future pandemic management from elected governments. You might not have been aware of this. It's barely been covered in the mainstream media, but I've certainly been keeping an eye on it, along with many of my other anti-lockdown campaigners. One campaign group calls this a huge victory for democracy, free speech and human rights. Well, joining me right now to discuss this is Carl Heneghan. He's Professor of Evidence-Based Medicine at the University of Oxford. Good afternoon to you once again, Carl.
Good afternoon, Julia.
Thanks for joining us.
Happy St. George's Day.
Happy St. George's Day to you as well. We've been talking about that on the show all morning. Now, most people won't know anything about this, but of course we had lots of advice from the World Health Organization during the pandemic about what we should and what we shouldn't do. And of course, most of it, in terms of supporting lockdowns and masks and the like, going against every bit of pre-pandemic planning we had, not just in England and the rest of the UK, but also World Health Organization research and planning as well. And there has been a move in recent years since the pandemic for the World Health Organization to basically take over the planning and the managing of pandemics from national elected governments, basically saying, we're much better at this, we'll take it over rather than individual governments, so it's across the globe. Given what we've gone through over the last few years, given the aftermath of some of that terrible decision-making, something that actually filled me with absolute horror. But there has been a big climb down on this. This is a victory, isn't it?
Yeah, so these are the international health regulations, which are a legally binding instrument across 196 countries, which they've got about 4 weeks. In May, the World Health Assembly will meet to sign off on these. Boris Johnson signed us up to these about 2 years ago in the midst of the pandemic, when there was all that panic and anxiety, thinking this would be a good idea. What's happened here, the language has changed from should to shall. It's had it in words like added in accordance with national law and context. So that actually they're ceding back because they know a lot of member states are worried and concerned in 2 ways. One is the sort of poorer states are saying, hold on a minute, this is big business and the big companies trying to sell us drugs and vaccines and sell us things we don't really need and make us have them. And then some of the other countries are going, hold on a minute, what about our national and local laws? They're the ones that should supersede what's going on.
Yeah.
But there is a very important bit of this, Julia, as well, is they're trying to define what a pandemic is and what a pandemic emergency is. And I actually am concerned about that bit because, boy, is that subjective. They might as well have said the director of the World Health Organization can call a pandemic whenever he feels like, because it is very subjective and parts of this treaty are poorly written.
Yeah, well, that doesn't surprise me with the World Health Organization. I mean, they, you say that crucially, they'll be non-binding. I mean, the fact that any government thought they would sign up to this, it was bad enough that our own government, without much democratic oversight at all and certainly no cost-benefit analysis, launched us into lockdowns and continued lockdowns and repeated lockdowns, despite complete and abject lack of evidence that they would actually long-term save more lives than they would cost. And we're seeing the fallout from that in terms of excess deaths now. But crucially, this is extraordinary. Like, there was one proposal which would have erased reference to the primacy of dignity, human rights and fundamental freedoms. That has been dropped. But also allowing the World Health Organization to intervene on the basis of a mere potential health emergency. They've dropped that plan. It must actually be about to happen, actually already happening or likely to happen. Before the World Health Organization could be involved. But it wasn't just about measures to, save, what they would think was saving lives in terms of getting in equipment or drugs and making sure that these things were circulated quickly to countries that needed them. The proposals also were including constructing a global censorship and information control operation. Now, we had an extraordinary level of information control and censorship during the pandemic, and that was why an awful lot of people like you and me, there were attempts to shut us down, and your colleague Senator Gupta and others, people just trying to suggest another way forward. Many of the things that people who campaigned against lockdowns and various policies, vaccine mandates, masks and the like, people criticised for being, COVID skeptics, and lots of other slurs were thrown around. Granny killer was one of them. We've been proved right on pretty much all of the things that we objected to, have we not?
I'd go beyond pretty much. I'd say all of the things we objected to. You're right. I think, Julia, people like yourself, myself, would be at the top of that list. I think what we're seeing across the board is people are starting to rail against this sort of globalism, which says we can control you in many ways. And in what they're saying is, for instance, if 196 countries, we call a pandemic and we want to close airports, all 196 of you are going to close. If we want to make you mandate to all wear masks, we're all going to do it together. So that's the problem with the globalist approach, is you suddenly go, but we didn't get a Sweden. That gives us the whole control group and says, actually, many things didn't work as expected. I think the key here is what the WHO should be looking at, and is saying things like, right, we've looked at schools, we've tried to look at them, we have information in influenza, we now have information in coronaviruses. What they show, if you look at it, is they don't work. So next time round, we're going to come out to you and say, the evidence is, and we've tried these exposures, actually not only do they work, what you're alluding to is actually the consequences are so severe, the harms are so bad and last for so long, that actually they're going to be detrimental to any pandemic planning. If they did that, what they could do is look at the array of interventions and start to go, do you know what? We realize that many of the interventions where we try to control the population just don't work as expected and have huge negative consequences. And therefore, we're going to go for localism as opposed to this global approach, which actually I think many people are now railing against. And actually, politicians should take notice. People don't want to be told what to do. They want to make choices for themselves.
Well, exactly. And in fact, like all of these international bodies, trying to expand its influence even wider. We've seen this. One of the things they were looking at was basically provisions to expand the scope of these sort of international health regulations to include, this is extraordinary, all risks with a potential to impact public health. So all risks and potential to impact public health. That could also include things like climate change. Now, that's been deleted, but you know, this would have been used, this measure, of basically saying, well, we're just going to completely control what your government can do because of the risk, potential risk, again, totally unproven, that climate change could cause human suffering. Now, it is extraordinary how many of these supranational bodies exist and how many of them are seeking to sort of have bigger and bigger powers at a time when, I suppose, lots of governments, weirdly, don't seem to want their individual voters to have a say over what they do. We had extraordinary little scrutiny of the laws that were brought in to sort of lock us in our homes for 23 hours a day and ban our children from going to school and covering our faces for hours and hours on end every day. And the idea that we would hand over even more of those powers to a body that is totally unaccountable, that we could never vote out, would have been extraordinary.
So one of the key things you're saying is everybody wants to have influence, but nobody wants to be accountable. Nobody wants to look and say, well, we got it wrong. It was my fault. I'm the person accountable and I'm standing around. It's like the waiting list. Nobody can tell you who's accountable for the problem. But one of the key things is, you're right, it says pandemic emergency, and a pandemic emergency will come before a pandemic. And the definition there includes is likely to exceed the capacity of health systems to respond. So you could argue that we are in a pandemic emergency with 7.5 million people on the waiting list.
Every winter in the NHS.
Yeah, every winter we are in a pandemic emergency. But the other flip side is, if you use their definition, a pandemic is defined as exceeding the capacity of health systems to respond. Under that definition, you could argue that COVID was never a pandemic because the health system did have capacity and did respond. So we may find ourselves in this pandemic emergency all the time, but never in an actual pandemic situation.
It's just quite extraordinary, isn't it? Again, seems to me in anything, any organisation that has any power to control our lives in any way should always be accountable to us. And WHO certainly isn't, barely accountable to the governments.